Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. New feature here at GoLocal. We started off last week, got a great reception, is Dr. Phil Chan, a top physician here in the state of Rhode Island. And we're taking on sort of the top healthcare issues that are now hitting the state, hitting the country, and having a discussion about it. Dr. Chan, thanks so much for joining us.
Thanks again for having me.
Okay, let's jump to it. Yesterday, the Department of Health sent out a press release announcing that 900 people already this winter have been hospitalized due to Novovirus, RSV, or the flu. It's the highest number of hospitalizations tied to these infections in the last 5 years. Let's go through them. What's your thought about the cumulative effect and how hard these are hitting the hospitals?
So we're seeing a huge year for flu virus, unfortunately, here in the state and across the country. I mean, the CDC estimates that over 29 million people in the US have been infected by flu. So, I've heard this referred to as a quademic with norovirus, flu, RSV, and COVID as well. But regardless to say, these are putting tremendous stress, not just on the hospitals, but the outpatient, the primary care providers in general. It's been really difficult to get in to see a doctor.
And what's the impact? Because, listen, if everybody's trying to go see them about these sort of seasonal infections, some of which can be quite serious, especially based on age, young people, older people, usually take the brunt of the flu. That impacts our whole, shall we say, very fragile healthcare system in Rhode Island.
Absolutely. I mean, we are seeing people die from the flu, not many, but some. Here in the state of Rhode Island this year, we've had 7 people who've passed away from the flu. We've also, in the last 7 or 8 months, still had over 100 people pass away from COVID. And I'm reminded, Josh, that to your point, that as people utilize healthcare resources appropriately for these infections, it takes away from other things, right? People that are having strokes or heart attacks, and it just puts pressure on our healthcare system. And when things are over capacity, sometimes mistakes are made, or sometimes care is delayed.
Yeah, you don't want to be going to the emergency room at Rhode Island Hospital right now. That is not on anyone's bucket list, shall we say. Let's break these down. Let's go through them one at a time. Novovirus, what is it? How do you get it? How do you get rid of it? What are you going to suffer from?
So norovirus is one of the most common viruses in the world that causes what we call gastroenteritis. And that means essentially GI distress, stomach pain, nausea, vomiting, diarrhea. It's very stable in the environment. It's very difficult to kill. Things like alcohol and chlorine don't kill it. And when people get it, it usually causes things like stomach pain, throwing up, diarrhea for a few days, and then it goes away. It's usually pretty self-limiting. People can get it through food, through schools, just being in groups of people. Again, it's probably the most common cause of GI upset. And if you've had GI upset, certainly in the last month, my guess is it's probably due to norovirus.
Okay, let's go over the flu. The flu is a killer, especially amongst older people and sometimes amongst children. Why this year? Is there a decrease in people getting the flu vaccine, or is this one of those years where the flu vaccine isn't matching up with the flu very well?
So great questions, and it's a combination of all the above. So one thing about the flu is that it does mutate from year to year, and that's why we need a new flu vaccine each year. And so some years it just kind of hits that mark where it's just more, causes more severe disease in humans, unfortunately. And it seems like this year is one of those years. But also to your point, Josh, we are seeing really low flu vaccine rates across the country in general, around 40 plus, a little bit above 40%, which is way down from previous years. And also to your point too, there is a degree of best guessing based on science and data in terms of trying to match the vaccine against the flu. And it appears this year with some very early reports that the flu vaccine may be a little bit less effective than prior years as well.
Does that mean get a second shot? I got a shot in November. Should I get a second shot, or is it just a miss?
It's just a miss. You should still get a shot even if you haven't. for everyone 6 months of age and older. It is recommended. I certainly got mine as a healthcare worker. And I'm reassured too that people are working, scientists are working on newer flu vaccines. And really, the holy grail of flu vaccination is going to be a one-time flu vaccine. So more things to come. There's a lot of smart people working on it.
Okay, let's go to RSV. What is it? How do you get it? How do you get rid of it? And how deadly is it?
So RSV is another one of those respiratory viruses. If people remember, we've been talking about this triple threat of RSV, COVID, and flu. And we're increasingly recognizing in the adult world that RSV can cause significant disease. So it's another respiratory virus. It's really indistinguishable from flu and COVID, causes the same things: fever, cough, congestion, malaise, things like that. Historically, RSV has been a very significant infection, especially in young children and infants less than 6 months of age, where it causes very severe lower respiratory tract disease. And we're increasingly recognizing it in adults as a significant cause of hospitalizations and even deaths, specifically in people that are immunocompromised or older.
Have we had any deaths tied to RSV in Rhode Island that you're aware of?
I'm not aware of any, but I wouldn't be surprised if we had a couple.
Okay, and then last, everyone's favorite, everyone's discussion point, COVID. Walk us through where we are, and are we back to sort of, it's really wiping out the nursing homes? Is that really where it's hitting hard?
COVID still continues to affect those that are a little bit older, elderly, as well as those that are immunocompromised. So yes, we're still seeing severe disease. We are still seeing, on average, a couple deaths a week, unfortunately. It's not spreading as quickly through some of those congregate care settings, nursing homes, et cetera. We are still seeing, though, a number of outbreaks that the health department and other doctors are responding to. So yes, it's still happening, but due to the vaccines, due to what we've learned over the last several years, it is becoming less severe over time. And I think to your point, Josh, we are seeing actually flu this year be more severe at this point than COVID, which seems to be trending a little bit down.
So if you look at these numbers, and I'm not sure exactly when they click the clock to say this season, but let's just say over the last 2.5 months, 900 hospitalizations. That's 10 to 15 hospitalizations on a daily basis. This isn't emergency room visits. This is hospitalizations, right? I mean, this is you're getting checked in, you're getting oxygen, you're getting treated. This puts a lot of stress on when will this begin to phase down? Will it phase down, or could we see this run all the way through March like we have in some years with the flu?
So I'm optimistic that we're already seeing signs of slowing. I think we're basically at the peak right now, but I'm optimistic that things from this point out are going to slowly decline. We may still see some new cases into March, but I think that we're at the top for both COVID and flu, and now we're on the downslope, hopefully, the early downslope, certainly of COVID, and hopefully of the flu as well.
Is there any thought that this is tied to the return to offices? A lot of companies are pushing their employees to come back into the office for 4 or 5 days a week, and then correspondingly, as viruses begin and start to spread, there's more spread because people aren't working at home.
I think over the last year or two, certainly when return to work was a thing after COVID, absolutely. We saw these respiratory viruses start to peak up again, RSV, flu, et cetera. At this point in time, I really do think, especially for the flu, that this is just a more severe flu strain. Certainly it's propagated and facilitated by folks socializing and being together in schools, et cetera. And this is normal, by the way. This is, if people remember, this is what normally happens during the course of a winter season, which is why we tend to see things like flu and RSV. So I wouldn't say it's necessarily back to return to work, but it's due to the colder winter months, everyone being inside, everyone being together, which is, what's happened over the course of history.
And then if we go to the Vatican City, the Pope is in the hospital with severe lung infections, pneumonia. Talk about that, what that impact is for him potentially, but is that sort of tied to these same, trends that are going on?
Absolutely. I think the Pope is older, so people who are in that age period are going to be more susceptible to all these respiratory viruses and certainly more severe disease. And the Pope is someone that obviously is shaking a lot of hands as part of his job. And I think he caught a bad case of something. And certainly the older you get, the little bit less likely you are to respond to things over time.
Okay. What's the lessons for people? What should they be looking for?
I think the lessons are just to take routine, reasonable precautions. I mean, we're sort of in a place now where we're not talking about everyone masking, obviously, or avoiding, socializing, but just encouraging folks to do the basics. Wash your hands, right? When you come home from school or work, wash your hands. Wash your hands after going to the bathroom. Basic like life lessons like that. And if you are sick, if you do have certainly a fever, make sure to stay home. Stay away from other people for a day or two until your fever and symptoms resolve. Basic sort of reasonable approaches like that.
Wonderful. This cold, cold, cold weather can't be a help either because everyone is indoors. We're looking at about 10 days of sub 30 weather. I went out this morning. My phone said it feels like it's 7 degrees. It did feel like it was 7 degrees walking the dogs this morning. So that can't help the strains being controlled.
Absolutely not. And that's why we tend to see these respiratory viruses during the winter months when it kind of forces everyone inside because it's so cold out.
Dr. Phil Channa, as always, thank you very much. We greatly appreciate it. For everybody else, stay tuned. There's a lot going on. If you haven't seen it, there's an in-depth article on GoLocal about the city's finances, trouble already existing. The mayor's dubbed this a financial crisis, big tax increase in the future, but also at the risk is about $170+ million in federal funding that could be targeted by the Trump administration. That would not be good news for Providence homeowners or renters who would see the brunt of that. Everybody stay tuned for much more. Stay warm. Take care. PC plays tonight. Thanks, everybody.